5 warning signs that may indicate the end of life, and what to do about them. Did you know that more than 70% of seniors ignore symptoms that could indicate their health is rapidly declining? Our body is a complex and incredibly intelligent system, capable of sending clear signals when something isn't functioning properly. Changes in the skin, excessive fatigue, persistent pain, or even sleep disturbances can all serve as important warnings to help prevent more serious issues. Today, let's dive into 9 signs that could point to serious health problems and, if ignored, might put your life at risk. But don't panic. There's hope. Recognizing these signs and taking action in time can make a difference and might even save your life or the life of someone you love. Let's begin with the first critical sign: unexplained weight loss. One of the most alarming warning signs that the body may be reaching its final stages is unexplained weight loss. This isn't the kind of weight loss that comes from healthy dieting or increased physical activity. This is sudden, significant, and happens without any clear reason. As we age, weight naturally fluctuates, but when someone loses 5% or more of their body weight over a short period, especially if they're over 60 years old, it can be a sign of something serious. This type of weight loss often occurs because the body is no longer able to process nutrients properly. Conditions such as advanced cancer, heart failure, or chronic infections like tuberculosis can cause the body to burn calories rapidly, even when a person isn't eating less. Another key factor is muscle wasting, which often accompanies this weight loss. This occurs when the body starts breaking down its own muscle tissue to survive, a clear sign that something is deeply wrong at a systemic level. If you notice a loved one suddenly losing weight without explanation, it's critical to consult a doctor immediately. The next warning sign is something many people experience but often dismiss: persistent fatigue and weakness. While it's normal to feel tired after physical activity or a bad night's sleep, this type of exhaustion is entirely different. It's constant, overwhelming, and doesn't improve with rest. This kind of fatigue often happens because the body is diverting energy to vital organs struggling to function properly. In end-of-life stages, the heart, lungs, or kidneys may work harder to maintain basic functions, leaving little energy for anything else. Additionally, illnesses like advanced cancer, chronic obstructive pulmonary disease, or severe heart failure often cause this persistent weakness. It's also common to see a reduction in daily activities. Tasks that were once simple, getting out of bed, walking across the room, or even eating, become increasingly difficult. When paired with a lack of energy, these changes can indicate that the body is prioritizing survival over mobility or activity. If you or someone you know is experiencing this level of fatigue, it's vital to seek medical advice. Persistent weakness can signal a need for urgent medical care or even adjustments to current treatments. Before the next topic, I created a longevity guide to help you have more vitality and live better with more confidence and practicality. You can access it to claim your free gift. Next, let's explore another sign that's often overlooked but deeply concerning: breathing difficulties. Breathing is something we often take for granted, but when it becomes difficult, it can be a serious warning sign. Shortness of breath, also known as dyspnea, or irregular breathing patterns, such as shallow or labored breathing, often occur in people whose bodies are struggling to maintain oxygen levels. These symptoms are common in conditions like heart failure, where the heart can no longer pump blood efficiently, or lung diseases like advanced chronic obstructive pulmonary disease or pneumonia. As these illnesses progress, the lungs and heart work harder, and the person may begin to feel breathless, even while at rest. One significant breathing pattern to watch for is Cheyne-Stokes respiration, a cycle of shallow, rapid breaths followed by periods of no breathing. This pattern is often seen in individuals nearing the end of life and can indicate the body is preparing for its final stages. If you notice a loved one struggling with their breathing, don't ignore it. There are medical interventions such as oxygen therapy that can help make their breathing easier and improve their comfort. The next warning sign involves the mind and emotions, cognitive and behavioral changes. When someone is approaching the end of life, their mind often begins to show signs of decline. Cognitive changes can manifest in various ways, such as confusion, memory loss, or even sudden shifts in personality. These changes can be distressing for both the individual and their loved ones, as they often indicate that the brain is not functioning as it once did. One common condition linked to these symptoms is delirium, which causes sudden confusion, disorientation, and difficulty focusing. This can be triggered by infections, medications, or organ failure. In other cases, progressive neurological diseases like dementia or Alzheimer's may worsen significantly during the end-of-life stage. Behavioral changes can also occur, such as withdrawal from social activities, irritability, or emotional detachment. This is often the body's way of conserving energy and preparing for the inevitable. Emotional changes like increased anxiety or sadness may also reflect the individual's awareness of their declining health. For caregivers, offering comfort and reassurance can help alleviate distress. Consulting a healthcare provider is crucial to determine whether treatments could improve the individual's quality of life. The final sign we'll discuss is one of the most visible and impactful: loss of appetite or difficulty eating. One of the clearest signs that the body is nearing the end of life is a loss of appetite or difficulty eating. As the body starts to shut down, its need for energy decreases significantly. This often leads to a noticeable decline in hunger and thirst. People in this stage may begin eating much smaller portions or avoiding food altogether. They might also find it difficult to chew or swallow, which can occur due to weakened muscles or neurological issues. Liquids may become easier to consume than solids, and even favorite foods may lose their appeal. This process is a natural part of the body's transition. The digestive system slows down because the body is focusing its limited energy on vital functions rather than processing food. While it can be tempting to encourage someone to eat, forcing food can cause discomfort, such as nausea or bloating. Caregivers can offer support by providing softer foods, high-calorie supplements, or simply keeping the individual hydrated with sips of water or ice chips. It's also essential to consult a doctor for guidance on how to manage nutrition and ensure the person's comfort. Recognizing these 5 warning signs can help provide better care and ensure comfort during life's final stages. If you or a loved one experiences these symptoms, consult a healthcare professional immediately to explore options for treatment. If you found this video helpful, please give it a like and share it with someone who might benefit. Don't forget to subscribe for more tips on healthy aging and longevity.